Assalamualaikum warahmatullahi wabarakatuh. My name is Tengku Reza Alfisyah from Syahkuala University. I will begin my presentation a case report with the title Quality of Life Patient with a Total Laryngectomy followed by Radiotherapy. For introduction, laryngeal carcinoma is one of a malignant neoplasma in head and neck. Prevalence was 8 to 10 people in 1 million population per year. From ENT department, Zainal Abidin Hospital reported there is 69 cases of laryngeal carcinoma from 2017 to 2018. Smoking, drinking alcohol was the main risk factor for head and neck cancer, including larynx and hypopharynx. The diagnosis is made by anamnesis, physical examination, radiological, and histopathology were the gold standard for diagnose this disease. The main treatment for this laryngeal cancer was a total laryngectomy that followed with radiotherapy. Here is a case report. 60-year-old male came to emergency room with a dyspnea and stridor inspirational for about 6 weeks before, and getting worse in 3 days. Patients were also complaining hoarseness and feeling difficult in swallowing food for about 5 weeks. Patients were also a heavy smoker for about 2 packs in a day. In physical exams, we found that oropharynx within normal limits, neck node level 2 sinistra with dimension 1 times 2.5 cm, smooth surface and cannot be moved, and painless. We have done tracheostomy urgencies, fiber optic laryngoscope, and found that pedunculated mass at supraglottic that localized in thyroid cartilage. Thyroid cartilage remained intact and biopsy will undergo within the mass from supraglottic. In larynx CT scan, we found that mass in larynx cavity that extends to supraglottic and thyroid cartilage remain intact. There is no sign of nodule enlargement in CT scan. Result from histopathology was squamous cell carcinoma, and the patient was planned to surgical treatment of total laryngectomy. After anamnesis, physical examination, and CT scan with histopathological as a gold standard, the patient was diagnosed with laryngeal cancer stage 3 with T3N1 with no metastasis, and patient was planned to treat with total laryngectomy and follow up with radiotherapy. Here is the patient was under general anesthesia. We doing unilateral incision around neck, release the strap muscle, and thyroid thymus were aparted left and right, and maintained. Osioid were dissected and released within larynx. Trachea were incised below tracheostoma. Party wall were released from cricoid cartilage, and anterior of esophagus were hecting layer by layer. Larynx were removed and found that supraglottic was that extend to subglottic. The defect were closed with ficril layer by layer, and edge of trachea were sewn with skin upfront with nylon, and were closed with bandage. The keywords of this report are total laryngectomy, laryngeal cancer, quality of life. Inclusion criteria is patients with total laryngectomy in indication of laryngeal carcinoma with better quality of life. Chemotherapy were not included in this criteria. Based on NCCN 2020, patients with laryngeal carcinoma T3N1M0 should be treated with a total laryngectomy with neck dissection, following with radiotherapy was the main procedure, and it gives higher percentage of 5-year survival rate. Woodard et al. Said that quality of life from patient after laryngectomy followed by radiotherapy was a better quality of life, despite the patient unable to speak. Men are vulnerable to this neoplasma, suspected because in our lifestyle, men have tendencies to become a smoker and alcoholism. Based on literature, laryngeal squamous cell carcinoma, or SCC, is strongly linked to cigarette smoking. It is estimated to account for more than 70% of laryngeal SCCs and up to 89% in combination with alcohol. The author wished to determine the prevalence of cigarette smoking and alcohol ingestions among patients with laryngeal squamous cell carcinoma. Chronic exposure of upper airway epithelium to tobacco smoke has been shown to induce premalignant morphological change. These changes are accompanied by increasing chromosomal damage, which leads to formation of population of metaplastic epithelial cells. The main symptoms in laryngeal cancer were shortness of breath, hoarseness, and difficulties of swallowing. Hoarseness can be caused by disorder of the vocal cords, glottic clefts that become narrowed and cause shortness of breath, and mass in supraglottic can cause difficulties of swallowing. Patients were sent to get radiotherapy at Cipto Mangunkusumo Hospital after 5 weeks post-total laryngectomy. From literature, radiotherapy should start within 6 weeks and completed 14 weeks after surgery. Adjuvant radiotherapy should be given after primary surgical procedure for laryngeal and hypopharyngeal cancer, especially if there's a risk factor for early recurrence with extranodal growth, blood or lymph vessel infections, perineal growth, and narrow resection margins. We use questionnaire EORTC-KL C30 version 3 for assess the quality of life from patients. The questions such as, did patients always need rest, where patients have shortness of breath, and where patients feel nauseated and vomit. And the result was, the patient was good quality of life until now. The conclusion of this case report was total laryngectomy following with radiotherapy for laryngeal carcinoma stage 3 can improve quality of life. This picture was taken 2 weeks ago. Look how these smiles represent a good quality of his life. Thank you.